Therapists are just humans like you and me. They're fallible and they make mistakes, and sometimes those mistakes can hurt survivors of narcissistic abuse. Today I'm sharing with you exactly what therapist Stacy Harp told me she went through as she recovered from narcissistic abuse. We are exposing the dark side of therapy and healthcare for narcissistic abuse survivors. And we're getting specific on her opinion on the current state of psychology and social work in regard to narcissistic abuse recovery. So, let's get started. Closed captioning provided by Athena Moberg and CPTSDFoundation.org. My name's Angie Atkinson, and on this channel I offer free daily video coaching to help you discover, understand, and overcome narcissistic abuse in toxic relationships. I like to call it toxic relationship rehab. So if that sounds good to you, hit that subscribe button and let's get going. Stacy has appeared on the Fox News television show Dayside, as well as numerous radio programs nationally and internationally. Stacy earned a Master's of Science in Clinical Psychology from Vanguard University of Southern California and has been described as a gifted therapist and coach. Let's just jump right into our discussion. Is there any sort of ongoing effort to educate that community, and as far as you know, about things like NPD?
I think what happens, at least in my understanding, is that you have the Diagnostic and Statistical Manual of Mental Disorders, which is a joke. It's a huge, see, and this is good because I don't know what your opinion is on that, but it's a joke. When I was in grad school, I'll just tell you what they told me, okay? When I was in grad school, what they told me was that, okay, we have this book, we're doing this research. I could diagnose you with 12, 15 million things if I felt like it, according to the criteria. That book was designed for insurance purposes, pretty much.
I knew it!
It's true. It's absolutely true. And there's limited research on the mental disorders that they put in there. And some things that they call mental disorders today that wasn't, quote, a disorder before. And if you want to even go deeper, the psychopharmacology aspect of it with all antidepressants and all that, they do help some people. But I was also told in grad school by a very well-known guy, who I won't name here, that their goal was pretty much to medicate everybody, get people on that stuff. And I was on drugs for a long time. I took those stuff. I was forced to be on them, and it took me years to get off because they're addictive and they lie when they say that they're not. Plus, serotonin's created in your gut, not your brain. The advancement of probiotics, people are now talking a lot about probiotics. If you have a healthy gut, and you use probiotics, and you do basic exercise, it will do the exact same thing for your brain.
That's a huge deal. Thank you for sharing that.
And like essential oil, I'm sure you've heard of that, right?
Yeah, I've done whole things. Yeah.
So just as an example with that, one of the top medications they use for anxiety, lorazepam or Xanax, you could do that, or Ativan, whatever you want to call it. They have actually done double-blind studies showing that if you ingest lavender essential oil, that it actually gives you a better or same result as taking those medications. They did a double-blind study actually showing that. And so the essential oil people now are under attack. They're trying to deregulate or regulate or whatever it is, because a lot of people who are becoming more holistic are getting away from the medication. Yeah.
I've seen a lot of that. Obviously I don't deal with medication at all when it comes to what I do, but I have personal experience with it. I was put on medicine that I shouldn't have been on when I was a teenager because I was not always compliant with insane demands. I look back and I see how I was, and I realize I was not a bad kid.
No.
I was just a regular kid and a really upset kid because I was in trouble all the time and scared to go home and that kind of stuff, but also very controlled by home. But when I became a teenager and the emotions came out, even though I didn't want them to, I became a problem child. And so then they put me on a lot of things they shouldn't have. And, I'm glad that I didn't get too much brain damage, but it really wasn't okay.
And can I add too, you talk about weight gain. One of the nicknames for Paxil is Pack It On with Paxil. I heard that from a doctor.
And that's one of the things they had me on, FYI. Paxil, then Zoloft, then eventually Prozac.
I did Prozac, lorazepam, Wellbutrin, which was designed to help people stop smoking.
I tried that one too.
I ballooned up to almost 300 pounds, and I'm a little bit less than that now, but it wasn't until I got off all that stuff, which took me years to do, actually, that the weight started to come off.
Lucky for me, I didn't have health insurance in my early 20s. So I got off those drugs when I became an adult. But
Good.
You know, but at the same time, I'd struggled with weight for other reasons. I mean, I
Yeah.
did get back on Prozac after I got divorced from my ex-husband, who was pretty narcissistic, but only for a few months at that time, and then I got right off. But you're right, they make you gain weight, and nobody tells you that. And you even can tell your doctor, I'm trying to lose weight and I'm depressed, and they'll still put you on a medicine that will make you gain weight.
Yeah, and then what they do is they put you on other medicine that makes that medicine worse because of all the side effects. And then, I mean, there was a point in my life where I was agoraphobic. I was afraid to go out of the house. The only place I would go would be church and therapy, and that would be it. So I get it. I totally get it. And that's why I try to sound the alarm as much as I can.
Yeah, me too. I don't talk about medicine that much because I obviously am not qualified to do so, but I do talk about everything else for that reason. I want people to know that they're not alone and they're not crazy. It's become my whole mission in life to do that.
I think a lot of people are beginning to wake up to the big issue, you know. And then, of course, I know you talk a lot about the difference between borderline and narcissistic personality disorder. Well, I was diagnosed as a borderline, right?
I hear that a lot from survivors. Yeah.
But in grad school, the interesting part about that is that when I was trained with the MMPI to take that, like 15 years prior when I started therapy and I went into it, I had, you know, I was outside the norms on that. And so that therapist diagnosed me as that. Well, all borderline personality gets a bad rap. I edited that word. It gets a bad rap. And the reason why is because usually it's an attachment issue or an abuse issue. And it's people trying to figure out, how do I express what I need through all the trauma that I went through? And nobody's helping me. So, you know, hey, I'm going to watch TV. I'm going to act out. See how because in TV, we reward people who act out.
That's right.
You know, and so, okay, does art imitate reality or the other way around? Well, that's what happens with people. I remember when I was a young woman in my 20s, when I was first starting, I would do whatever I could to get somebody's attention. I would fake stuff. I'd be like, oh yeah, I'm in crisis, blah, 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 you know, because I saw a glimpse of what I wanted, and I'm not proud of it, to be honest. I'm not proud of it. But now that I'm 50, I'm like, oh my gosh, I noticed that. And what most people need to have that is they need solid boundaries with somebody who can contain that, and they need a place to be able to feel safe and deal with their anger. If they can see that without somebody abandoning them in that process, then that's where the comfort comes in, and that's what people are looking for. So 15 years later, when I'm going through my grad school thing, I have to take the MMPI. I went ahead, took it again. I scored in the perfect ranges for that. I actually have proof that I was crazy here, and now I'm not. It was funny is I shared this with my therapist, and she was, at the time, was my therapist, and she's like, wow, this is evidence of the fact that you actually did the work. Because you know what? Most people don't do the work.
I agree.
They don't.
And I'll tell you something. I'd love to hear your thoughts on this. When I see a survivor who says they were diagnosed with BPD, I think sometimes maybe they should have been diagnosed with CPTSD. What do you think about that?
I agree, because I also suffered with PTSD for years.
Imagine you did.
I did. With all the abuse I went through, I did. I actually did. And I think that's probably more of what it was. I mean, between flashbacks and anxiety and, you know, a doctor's not listening to me about like what it was that I'm really dealing. Like I had a psychiatrist who was friends with the therapist. I was trying to deal with my anxiety. So he was putting me on all these anxiety medications, and none of them were working. Well, guess what I found out? After that, I told my therapist, I said, this last one was like, I think it was Stelazine or something. And that stuff like made me feel like they pulled like a dark shade over my head and I couldn't see anything. It freaked me out. I found out, you know what I found out?
What?
I was iron deficient. So here's the thing. Check this out. If you're severely anemic, like I was, your blood isn't producing enough oxygen for you to breathe. So if you're having a hard time breathing, that freaks you out because you can't breathe.
Right.
So one of the first things a good therapist will do is say, go get a medical evaluation, get some work done to figure it out. If that had happened way earlier in my life, because that ended up being tied to my health, which was, horrible. I had endometriosis. I had a uterine cancer scare, so I had to have a hysterectomy when I was in my early 40s. And lo and behold, poof, all those symptoms just happened to go away after that Gosh, I wonder why. Because I was in therapy learning cognitive behavioral techniques, replacing my thoughts. And that's, the neuroplasticity of our brain, which is awesome. And God was so
Yes.
good when we did that. I mean, we could totally rewire our brain, which blows me away.
This person asks a question that I thought might be helpful. I'm going to try to summarize it. Basically, she says she had a good therapist before, and that person moved away from where she was living, and now she's got a psychologist. The old therapist, she says, was a clinical social worker. Now she's working with a clinical psychologist. She said the new therapist refuses to acknowledge that she is in the process of overcoming narcissistic abuse from an 8-year-long relationship. She says her ex was not formally diagnosed, as we all know. They're hardly ever actually diagnosed, right? She just figured out 6 months ago that he's probably NPD, but she knows it's typical that people miss NPD, but her therapist won't work with her on abuse recovery because he says that she doesn't have any proof he was a narcissist. And she said, the therapist consistently interrupted me, would not let me explain the trauma. She tried to explain the trauma and he won't hear her. And she says, please help me find the words to say to the therapist about validation of what I've been through and being free to speak. And I just would say to her, personally, you need a new therapist. But what would you say?
I feel like I'm a jerk and she needs to get a new therapist as well. I mean, it sounds like he might be a narcissist himself.
Agreed.
If a therapist doesn't do their own work, then they make the sessions about them and their perception. It's not. Right. One of the things I was taught, and here's the truth, most of my supervisors were like really, really extremely liberal, and I'm not. I'm very conservative. But I was actually taught, hey, it doesn't matter what you think. You listen to the story, because what a person tells themselves is their reality, right? Now, whether or not you agree with their reality or not is, it doesn't matter.
Relevant. Yeah.
Right. I mean, the way that you got to tell your story. And if somebody's not validating your story and you're paying them, go somewhere else.
I agree. I just noticed here she did mention that part of her problem is her health insurance. But I will say this about your health insurance. I actually have a little bit of a background in health insurance. Even Medicaid programs, you can call them and say, I'm having trouble with this person, this doctor, and they'll help you find another therapist. Just because the insurance chooses to use that clinic doesn't mean they only use that clinic or that therapist. I mean, 9 times out of 10. So keep that in mind. If you'd like to see the rest of Stacy's interview, you can click the card right here and subscribe, as I'll be posting the last part of her interview next week. Stay tuned. All right, now this brings me to the question of the day. And the question of the day is, have you had experiences with a therapist or anyone in the medical community who caused you additional trauma while you were trying to recover from narcissistic abuse? Share your thoughts, share your ideas, share your experiences in the comment section below, and let's talk about it. If you want to learn more, make sure you take a look at the video I'm leaving for you right there, and it will give you so much more information about this. Before I go, I want to offer a quick shout out and a big thank you to all of my channel members, those people who support me through the YouTube membership program. You are awesome and amazing, and I'm so grateful for you. I'm going to show you their names right here. And I just want to say again a big thank you to each and every one of you. With your help, I'm able to continue to provide free daily video coaching, free resources at queenbeing.com, free videos like this one to help people get through the hard times, discover, understand, and overcome narcissistic abuse in toxic relationships, and to evolve to the next level of their life. Thank you so much. Sincerely, it means the world to me, and it is my mission in life. Thank you. Again, I just want to say to my inner circle, thank you so much for hitting that join button. It really does mean a lot to me to know that you're supporting me. Thanks again from the bottom of my heart. And to you who's watching my video right now, thank you. Thank you for being here. Thank you for liking, commenting, sharing my video. It helps me. Every action helps me to do just a little more for this community, and it means everything to me. Again, thanks so much. As always, thank you so much for being a part of my day and a part of my life. And hey, thanks for letting me be a part of yours. It really does mean a lot to me. Make sure you take a look at the videos I'm leaving for you right there and right there. And while you're here, hit that subscribe button right over there so we can stay connected and continue on this healing journey together. I'll see you soon.